Hello, welcome again to our YouTube channel. It's Dr. Dan Eli, a consultant obstetrician in Blown Women Health. Today, I want to discuss with you another common problem I get in the clinics. There is an issue of recurrent pregnancy loss. We define recurrent pregnancy loss if a woman has lost more than 2 or more pregnancies subsequently following each other. That is when we think that somebody's had a recurrent pregnancy loss. There are many causes of recurrent pregnancy losses, and the commonest cause usually is chromosomal problems. 50% of recurrent pregnancy losses occur usually in the first trimester, that's below 13 weeks of gestation, and most of these are really chromosomal. And the main chromosomal anomaly that usually result into recurrent pregnancy losses are usually aneuploidys, and then we also have other structural causes of recurrent pregnancy losses. And because of that, at times we need to do genetic studies, and unfortunately in most of the clinic settings and in our facilities we do not have the capacity to do genetic studies. But that should be known to mothers that one of the commonest causes of early pregnancy loss is usually often due to chromosomal factors. There are also other causes such as anatomical structures. There are some women who, especially those who have never conceived before, who have been having recurrent pregnancy losses. They can be having that problem just because they have a structural problem with the uterus. So in the embryonic development of the uterus, usually uterus has initially 2 horns which are supposed to join together, and then there are supposed to be some other aspects of remodeling which happen within the uterus. But unfortunately, there are times when there are some abnormalities with the uterine structure. Either there's only one horn of the uterus which is formed, which we call a UNIconuate, or you'll find that the 2 horns are still independent. So in the process, you do not have a single space through which the baby can be able to develop, which we call Biconuate uterus. And then there are times when the 2 horns can join, but inside there where they've joined, there is a septum which forms, which we call septate uterus. And naturally, after the 2 horns have joined, the septum in between is supposed to kind of be remodeled, if I can say, disappear during the development stage. And when that happens, it will be very difficult for implantation to take place effectively. Of course, some of the causes which are structural can also be things like uterine fibroids. It can also be following maybe a previous miscarriage. Depending on how you manage, there's a condition we call as Asherman syndrome, where there's a scarring within the uterus layer, which means that the endometrium cannot be able to engorge well, or there are adhesions within the uterine cavity. And once you have that, it becomes extremely very difficult for you to be able to conceive. And then we have another common cause of recurrent pregnancy loss is what we call as luteal phase defect. And during luteal phase defect, there is insufficiency in a hormone called progesterone. Progesterone is a very important hormone early in pregnancy. It tries to keep the uterus quiet, because you know that the baby that we have is a foreign body inside the uterus. So usually otherwise the uterus will be contracting. Naturally, if there's anything foreign in the uterus has to contract. And because of that, usually you need to have sufficient levels of progesterone. But early in the pregnancy, it is not possible because there is no placenta formed. The little progesterone formed from ovaries at times may not be sufficient. And when we make a diagnosis of this, usually we start giving early supplementation of progesterone to the mothers, and that way we'll be able to keep the uterus quiescent, and the pregnancy will be able to proceed normally. And in some situations also mothers have a condition we call antiphospholipid antibodies. It is really something to do with the coagulation problem. There's a clotting system dysfunction, and it accounts to more than 5% of recurrent pregnancy losses. So at times there may be need for us to do investigations to be able to determine this. But the management, it is a very simple management. So usually we put these mothers on anticoagulants, and as long as you make the diagnosis early, it will be very easy to manage cases like this. And then you need to follow these mothers very closely. Another common cause of recurrent pregnancy loss is I would call it autoimmune. It's related with maybe rhesus incompatibility. Rhesus incompatibility is a very serious issue, especially if the mother is negative and the husband, the father is rhesus positive. But if the reverse is true, it has no impact really on the child. So rhesus incompatibility mainly affects pregnancies, maybe the second pregnancy, or if a woman had a miscarriage before and probably it was not diagnosed, the subsequent pregnancy is usually at a risk, especially if we do not diagnose early. And later on you will realize that we actually have ways through which we can be able to manage this. The rhesus incompatibility, the only way to do it is to start antenatal clinics early, and you have a proper ANC profile where your blood group is detected. And once that is obtained, there will be no much big issue. Ladies and gentlemen, if it's your first time to be in this group, in this YouTube, if it's your first time to tune to my YouTube channel, I request you to subscribe, like, and even if you have a comment, you can be able to comment, or if you have a question, you can be able to raise a question. I'll be able to get back to you probably within 24 hours. Thank you very much.